If you're worried about developing dementia, if you're worried about your memory, then you should absolutely not keep that to yourself. There's no point in getting stressed or anxious about that. You should seek guidance and help. And the first person to see is your GP. And it's very likely that your GP will be able to reassure you, having examined you, that there's nothing to worry about. It's possible, of course, your GP will want to refer you on to one of our specialist memory services. And there again, you can be seen very quickly. And within a few hours, you can be told whether there's a problem that you need to take further help and treatment with, or whether there's something that can be put right straight away. So, for example, you might just have become anxious or stressed by things, and that might be affecting your memory. Well, the memory service can quickly detect that, and if that's the case, putting right that stress and worry will put your memory back so that it bounces back to normal and you haven't got to worry about it anymore. If the memory service discover that there is a problem with your memory, then you can be given access to all kinds of helpful things, as well as the Alzheimer drugs that we talked about earlier. I mean, it sounds simple, but often the most important part of memory assessment is just an expert taking a careful history about the problems that you've noticed, or that someone who lives close to you and knows you has noticed, and how they've developed over time. Someone like myself, who's sort of experienced and trained at investigating people with memory problems, will diagnose Alzheimer's disease on the basis of the history. So typically, a family member will say, I've been worried about mum for 2 or 3 years. I noticed a couple of Christmases ago that she seemed to have trouble remembering all the people that she should send Christmas cards to. And I've noticed when I've gone round to a house in the last sort of 6 months or so that sometimes the fridge has had stale food in it, and there have been bills on the kitchen table that she hasn't dealt with and paid as she would have done. And so often when a family member will tell us a story like that, we'll think, well, that sounds very typical of an Alzheimer's disease sort of picture, and we're not surprised when we then examine the patient to discover they've got the characteristic problems with short-term memory and orientation and recall that we classically see in the early stages of Alzheimer's disease. So dementia is a progressive disorder, and patients at different stages of their illness will have completely different needs for information and care. So at the early stages, what patients and their families really need is a high quality and clear diagnosis. They need to know exactly what's going on and what they can expect over the following years. And those are the patients that our memory services are set up to help. So we have memory services now that serve every borough within SLAM, and patients and the families who come to those services can expect to receive a very, very detailed assessment and to be given a absolutely cast iron, high quality diagnosis and a prognosis about what exactly they can expect to happen over the next few years. We can also give them access to psychological treatments. So many people become very upset and depressed when they're given a diagnosis of dementia. Many families find it very difficult to deal with the fact that their mother or their father or grandfather has been affected in this way. So we have excellent services to help families to come to terms with what's essentially the worst sort of news that you can get, really. We also make access easy to the memory drugs, and at the moment the drugs that we use most of are drugs called the Cholinesterase Inhibitors. And these drugs work by increasing the amount of a transmitter in the brain called acetylcholine, which helps memory. When people start on these drugs, they often don't notice an abrupt improvement in their symptoms, but in the majority of patients, families and doctors and patients will notice there's a difference, and that the patient is more with them in terms of their attention and their memory function. And certainly in the trials we've carried out, we've shown that these effects are about equivalent to 4 months' worth of deterioration in the disorder, which is, a small improvement, but it's quite an important one when we're talking about an illness that otherwise doesn't have a treatment. If you're a person with dementia and you're referred to our service, then our aim is to provide you with a service that's comfortable and good for you, and a service where you'll feel that you've been listened to, where your problems have been dealt with, and where you've gone away from us, not only with a plan, but also with a confidence that things are going to be a lot better for you than they were before you came to us.